Hi, everyone. I'm Paul Markovich, President and CEO of Blue Shield of California, and it's my pleasure to be joined here by Russ Glass, the CEO of Headspace. Russ, how are you doing?
I'm great, Paul. Thanks for having me. Good to see you as always.
Yeah, good to see you too. It is, before we dive into talking a little bit about Headspace, we're in Men's Health Month this month, and so I thought I'd just ask you a few questions about that. Music, is there something in particular you like to listen to that puts you in a good mood and the right mindset?
Yeah. Well, first of all, I love music. I heard this great quote actually not too long ago. If art decorates space, then music decorates time, which I thought was just a great way to think about it. But I'm a huge Bob Marley fan, and so anytime that I'm thinking about like I want to get a good vibe going, I want to relax, I throw some Bob Marley on.
That sounds good. That sounds really good. How about for exercise? I know I like to play hockey as a way to unwind and get a little exercise. What do you like to do?
I'm a pretty avid golfer.
Oh,
It's been harder with three girls at home to get the time, but I do try to make time for it, and I just love being outside. I love the focus it requires.
mhm.
It's a sport that has a very small margin for error, so you really got to be in it. And so it takes my mind off everything else. I'm in it when I'm in it, and I really enjoy that. I enjoy the fresh air, the walk, etc.
Yeah, that's great. I love to golf too, and can't quite do it as much for the same reasons. But so, how about, we know rest is important to physical and mental health. What does an ideal day off look like to you? What does it look like to get a break?
I'm a putterer. I enjoy. Actually, I discovered this. I was fortunate enough to get a little time off when between my last role and this one, and I just wanted to be dad. So the three girls
Hmm.
were younger, and so I took a bunch of time off, and I realized one, I really love my mornings. I like a quiet morning. I like to have my coffee outside. I like to read. And then I like to putter. I like to just see
Hmm.
what the day brings me versus having an agenda for the day. Like a day off to me is I don't have many plans, and I'm just kind of letting the day unfold as it unfolds.
Yeah. We know, particularly with COVID, lots of younger adults and people have had some struggles with mental health. What advice would you give your younger self to be better at preserving your mental health?
I really didn't understand the importance of sleep when I was younger.
Mm.
I I went to bed thinking about. I've been an entrepreneur my whole career. I went to bed thinking about the problems and often didn't sleep because I was ruminating, and then I'd go to work the next day and just not have my full facilities, right? Just the patience you need, the processing you need. As you know, I mean, we're solving hard problems almost every day, and when I really got a hold of my sleep patterns, and I am religious about 7 hours a night, if not some more. I show up and I can manage the ups and downs and manage
Yeah.
the stressors in a way that I was not able to when I didn't sleep as much.
Yeah, I've realized how foundational sleep is too, and I'm equally disciplined about making sure it happens. Good advice to your earlier self and to others. So tell us, you are an entrepreneur. You've been an entrepreneur in lots of different contexts. Tell us about your latest venture, Headspace, about what it's doing and how it's going.
Yeah, thanks. Headspace is a digital mental health provider that is revolutionizing how mental health is delivered and accessed. As we all see right now, there's a huge mental health crisis. People are increasingly finding themselves anxious and depressed. We see suicidality going up, and yet the way we deliver it in the space today isn't scalable, and so access is a huge problem. And so we're trying to solve that through prevention and reducing stigma with our well-known and recognized Headspace brand. We're trying to improve measurement and access to care by bringing people to the right level of care, depending on what their need is, and ultimately trying to bend the cost curve by making sure that people are getting in earlier and to the right levels of care before it gets more acute.
Could you say a little bit more about that? I call it the matchmaking process, like how you're trying to make sure wherever people are in that spectrum of being mentally and emotionally well versus not, how do you try and do that, matching them up to the right level of resource?
Yeah, good question. So what we've found is that people, for the most part, know they don't feel very well from a mental health standpoint, but they don't know what they need. They don't know if they need to see a therapist, or maybe they just need to build a mindfulness practice, or maybe they need better sleep. They're not sure. We have developed the ability to assess, to measure, to really understand what the need is, and then navigate that person, that member, to the right levels of care. And we use different assessments, some industry standard ones like the patient health questionnaire, which is, measures depression, and the generalized anxiety disorder questionnaire, which measures anxiety. We use PSS, which is perceived stress. And we bring all that together to bring them to the right level. And it turns out that the vast majority of people don't need to see a therapist. They might need support of some kind, coaching maybe, or self-care, but they don't necessarily need to see a therapist. And that's kind of a game-changing insight relative to how the system is working today.
Yeah. Well, I know you have your own mindfulness practice. When do you like to meditate, and have you already done that today?
I tend to meditate first thing in the morning. So when I wake up in the morning, it's one of the first things I do. I actually have meditated twice today because I did my morning meditation, and then we had our all hands today, and we start our all hands with a meditation. And so the whole company comes in, and it helps ground us. It helps leave everything behind that we brought into the meeting, and enables us to better focus on where we are on the task at hand. So I'm in 2. Maybe I'll go for 3 later today.
The hat trick, I like to call it.
Yeah, exactly. You're a hockey player, it's the hat trick.
Yeah. So, well, look, I think a lot of people would describe Headspace as a digital health application. There are more and more of those coming out. What do you see their future as, particularly with helping employers and potentially partnering with employers and others to improve health?
Well, first of all, I think we're in a world where Amazon, Google, these companies have created amazing consumer experiences, and they've really sort of changed the expectation from a consumer standpoint on what a great experience is. Yeah. And for the most part, healthcare doesn't live up to, right? Today's healthcare system doesn't live up to those, expectations. And so I think when digital health has the opportunity to deliver the experiences that customers expect now. And I think that the opportunity is that employers, health plans are increasingly realizing that the expectations are real, and as we move forward, being able to deliver against that, huge opportunity for engagement, huge opportunity for actually delivering care that meets people where they are and keeps them healthy and gets them healthy, right? And so I think that's ultimately the goal. Do they use it, and does it work? And that's what I think digital health can really bring to the table.
Yeah. Now, I have to say, I have a handful of constant frustrations with the healthcare industry, and one of them is that so many people use the standard of the experience for the member or the consumer or the patient being better than it was, as opposed to as good as it should be, as good as it is in other parts of your life. And I know for us, we describe our nonprofit mission as we're here to create a healthcare system worthy of our family and friends, and sustainably affordable. And we really think about how you'd want your loved ones to be treated at their time of greatest need. And that is not a standard that gets met very often in our world today.
That's right. That's right. The standard shouldn't be, is it better? It should be, is it actually good? Right.
Right.
And I think again, digital health, there's real opportunity to deliver against that promise.
Yeah. Agreed. Well, I think I've been peppering you with questions. Is there anything you want to ask me?
Yeah. Well, so first of all, I think you have really been a trendsetter in a lot of ways in how you think about partnership, how you think about, next generation approaches to healthcare. How do you evaluate? So when you think about bringing new partners into Revolution, when you think about bringing new partners into the ecosystem, how do you evaluate those programs?
Well, it starts with the standard we were just talking about. It's got to be worthy of our family and friends, or at least aspiring to be to that level, even if it can't initially get there. So we do ask ourselves whenever we work with anyone and trying to impact people's health is, if you had a loved one in this situation, is this something you would want them to have access to? And is it something that they are likely going to use? And is it actually going to improve their health in a meaningful way? And then, of course, the sustainably affordable part is important too. It's got to be commensurate, that the cost of that has to be commensurate with the value that it creates in terms of the health of the individual and more broadly overall. So we're really looking for partners that have that standard coming in and have created something that would be used and will have impact and is priced commensurately with its value.
And so if, obviously we've got a wonderful partnership now, but if you're someone new, if you're a digital health provider and you wanted to work with Blue Shield California, what advice would you give them in terms of how to do that?
Well, I'd say have some experience and some evidence that A, people use your tool, B, it has impact. And then the third thing coming in, well, I guess maybe I should say the letter C to keep on the same metaphor, but C would be really be thoughtful about how you price it. The number of times that entrepreneurs kind of come in and they say, well, on average, if there's no intervention on, I'll just call it diabetes, then our intervention will save $500. And so we should get $499 of that value. And that's how I'm going to price it. And they don't understand, first of all, we are actually not just sitting still as a health plan. We have other things going on trying to help with that impact. And so isolating the impact that you have is not an easy thing to do. And there are a lot of things that we have to do as a health plan in order to help make your product and experience work for our members. So I think they often make the mistake of trying to price for value that they think they alone are creating, and they kind of can price themselves out of the market a little bit. So I think it's got to be build something that's valuable and impactful, and then have the appropriate level of modesty when it comes to pricing the product. Like, it really does have to be tied to actual outcomes and incrementally, materially better outcomes than we have. And that value needs to be shared. So I think those are the elements that we're looking for.
Awesome. One of the things we talk about a lot is that we talk about mental health and behavioral health, but really it's just health, right? I mean, at the end of the day, it's all connected. It's all related.
Right.
How did, we formed this partnership probably a little over a year, maybe a year and a half ago now. Mm-hmm. How did bringing a partner like Headspace into the ecosystem contribute to the overall kind of whole health goal that you're trying to accomplish with your members?
Yeah. Well, first of all, Russ, I think one of the reasons we launched this and it's gone as well as it has is because you and your organization have fully embraced the idea of getting paid for outcomes, really developing something that is compelling in terms of its usage rates, which are some of the highest that we have on the platform, and its impact on members in terms of improving their health in a measurable way. And so, to me, that the fact that you've embraced those things and really pursued them with us has been, foundational to the making this partnership work. And I agree with you completely. Like we tend to make this distinction between mental and physical health as an industry, but when you talk to people, they just know when something's not right.
They don't feel well, right? They don't feel well. Yeah.
Yeah, I just things aren't going well. I don't feel well, and many times those mental and emotional challenges manifest themselves in physical symptoms, and people often pursue those physical symptoms in the the medical world, and they're not necessarily getting to the root cause of what's driving those things for them. So for us, look, we really just try to, everyone talks about personalizing healthcare. I think the fact is we are striving to truly understand each individual, what their circumstances are, meeting them where they are, which is one of the reasons I asked you earlier about that whole matchmaking process. Is a lot of the testing you're talking about and looking at it is where are you? What do you really need? What's really going to have an impact for you in your circumstances right now? And that's really what we're trying to do, because I think when you do that, your odds of being successful with that person, really helping their lives, making a difference in their lives, improving the quality of health is higher. And you're more likely to focus energy on the root cause, and in a way that's proportional to and specific to their needs. So that's what we're shooting for. I think that's the holy grail for all of us. And, hopefully we'll get there.
Well, and it's a win-win, right? I mean, if it's the right level of care and it's the appropriate care, they're more likely to use it. They're more likely to actually follow through with it. And it's not going to be as expensive as something that's heavier, but beyond the need. So right sizing that it's good for the whole ecosystem, right? It's good for the payer, it's good for the member, and hopefully it gets them healthy faster.
Well, we have a tendency. There are some drugs out there that can work wonders, and there's no question. There's times for people in these situations where drugs can make a big difference. So it does depend on people's circumstances, and I think the system in general is too quick to jump to that as a solution.
Yeah.
And what that tends to do is that does not always have the impact it's suspected to have. And it'll have side effects that people then start pursuing the side effects. And then we get into situations where, and then to deal with the side effects, another drug gets prescribed. So we can sometimes start down this path where we're trying to treat things chemically when we really need a very different model. And that's, again, what I like about the partnership we have and the approach that you take.
All right. Futurist hat.
Okay.
Next 5 years. What do you think? What do you think we look back 5 years from now and say, this is where digital health has gone?
Well, I think what we're going to see is, I think we're going to see a pretty big expansion of these tools. I think we're going to see, like in most industries, a winnowing out of those that actually provide value versus those that get hyped but aren't able to deliver. And I think you're going to see probably a lot of attempts by incumbents to acquire some of these assets and build them up. But to be honest, I think that there aren't many large established health plans or other organizations that are likely going to do that really well.
Yeah.
In part because they aren't necessarily taking the approach that I'm talking about. There tends to be it's often the case in the industry that folks try to pursue a tactical response. I need something in this space and in this space and in this space. And they're not thinking about it holistically, actually, as an organization, thinking about it holistically, or trying to bring a more holistic solution to the table. So to me, you're going to get an expansion, a winnowing out. You're going to have some numerous organizations at some point, how sectors get hot. This one could get hot in terms of acquisitions by incumbents. But I think the winners in this space are the ones that just focus on trying to create a healthcare system where they were family and friends and sustainably affordable by trying to take something and saying, this isn't working for people. How do I really make it work for people and to impact their lives in a meaningful way? Those are the ones that are going to win out in the long term.
I love it. Yeah, I agree completely. I think I would add, we're going to start to see brand affinity. I think in this world, I think people are going to start to have their favorites in these different areas. Like
figure out who to trust, right? Figure out who to trust.
That's right. That's exactly right. That's exactly right. Whether because friends and family have used it and they've said, hey, this really worked, or because they've used it themselves and they're going to go back to it when they have similar needs in the future. And I think that's going to be great. I think that brand loyalty is going to drive a lot of positive health outcomes when you find that trust. And then the second thing I'm really continuing to be excited about is something you mentioned, which is outcomes-based, value-based reimbursement, aligning incentives.
Yes.
So when people feel better, that's when the economics come in. And I'm excited to continue to lead the way with partners like you and figuring that out and making that, a reality at scale.
Well, Russ, I'm just constantly impressed with what you've been able to do with your company, but also how you personally walk the talk on mental and physical health and are an example of that to your employees and to your patients and to the entire industry. As the saying goes, what you do speaks so loudly that I cannot hear what you say. You're really quite an example. It's been a real pleasure having this partnership with you. It's been a pleasure taking a few minutes to chat. Thanks for taking time out. I feel like I need to catch up with you on your potential meditation hat trick after this.
Sounds like a plan. Ditto on all. Thanks so much for having me, and we'll look forward to seeing you soon.
Sounds good. Take care.